Hi, so we're going to have a series of fairly short lectures on the nerves of the upper limb. For each nerve, we will look at the course of the nerve in the upper limb and its motor and sensory supply, and finally some clinical correlations. When we're looking at these nerves, what I want you to focus on is what part of the brachial plexus the nerve arises from, important relationships in the axilla, arm, elbow, forearm and wrist. As necessary, not every nerve you'll need to know relations in each part like that. And then the muscles and nerves supplied and how that might affect clinical presentations of different injuries. So as always, we're going to start with a case and then discuss the nerve itself. So this is a 28-year-old footballer who presents to the emergency department with a dislocated shoulder. He complains of numbness over the shoulder. Pause the video and see if you can work out which nerve is involved here. Okay, so this is the axillary nerve. The axillary nerve is supplied by fibers from the C5 and C6 nerve roots, and it is a terminal branch of the posterior cord of the brachial plexus. The nerve passes through the axilla under cover of subscapularis and then winds its way from anterior to posterior around the surgical neck of the humerus, and we'll see that that is quite important in terms of injury. It supplies teres minor and the deltoid muscle, and may also supply the lateral head of triceps, and its cutaneous branches pierce the deltoid muscle and supply the area over the deltoid, what is called the regimental patch. So as we said, it supplies deltoid and teres minor and the regimental patch over the deltoid muscle. If the nerve is damaged, because of its effect on the deltoid, we have weakness of shoulder abduction and numbness over the deltoid muscle. And this can be seen classically in anterior shoulder dislocation. And if you think about that course of the nerve winding around the neck of the humerus, you can see why that is. With an anterior dislocation of the shoulder, the nerve is stretched and that can lead to injury. As you can see from the picture, the nerve also runs fairly close to the axillary artery in the axilla, and that is why sometimes you get concomitant axillary injuries with a shoulder dislocation as well. So if you have any questions, you can bring them up in class. In future videos, we'll look at some of these other nerves, the musculocutaneous, the radial, median and ulnar nerve. Thank you very much for your time.